Our whole purpose is to meet the needs of our community. We foster a program that's really built on being diverse, but also about being well and together and just having fun doing what we do. And hopefully when they leave here, they're gonna love continuing doing what they do. We're a small new program, but we got a lot to offer. Our fellowship is where after general psychiatry residency, you go and specialize in working with children and adolescents and their families to meet and manage their mental health needs. We have really thought about all the things that we wish we would have had, whether it was an experience, an interaction, and really try to put our heart and soul in this fellowship so we can better serve the community.
I had always known that I wanted to work with kids, and initially I was leaning towards pediatrics. But then I had my psychiatry rotation and I fell in love with psych. I was thinking about the kids that I worked with on my peds rotation, and it was always the kids that have, anxiety, depression, ADHD, psychosocial programs. Those are the ones that I was drawn to. So I decided, let's combine the love of, psychiatry and kids and do child psych.
Child psychiatry is a specialty where there is a shortage of professionals. We are always in great need.
There's one child and adolescent psychiatrist for every 900,000 kids that need one.
It's really hard to put into words, I think, like the job satisfaction, I think, that comes from helping a kiddo and family through a really hard time in their lives. You can make a difference earlier on.
I wanted an experience where I could have multiple rotations and get in a lot of different experiences, and JPS was able to offer that to me, and it's been great so far.
We get a very broad variety of exposure to things because Dr. Cologne made sure that our curriculum had everything.
We will move mountains to make sure we can at least find some way, shape, or form to get our fellows what they need, what they're hoping for. Not everything is always possible, but we will really definitely try.
We get exposure to eating disorders at the Eating Recovery Center in Plano. We get exposure to neurodevelopmental disorders at Nexus and at Cook's. We get exposure to forensics at the Tarrant County Juvenile Center area. We also get exposure at the North Texas State Hospital, which a lot of people don't get exposure to as well. I feel like every single thing that you're looking for in a fellowship program to just get a tidbit of exposure to, we're definitely going to have. And if there's something that you're interested in, Dr. K will make it happen.
One of the things I think trainees will get when they come here is that personal approach. There's not a whole lot of us, and so they get a lot of time with attendings and with faculty members. It's a relatively small program. It gives us the ability to give trainees the latitude to be able to try different things, but at the same time have a faculty member with them so that they can be assured they're not on their own. So I think it's a good balance of small program feel, but with a very strong emphasis on education, on learning, and on research.
Anything under the sun, literally speaking, or any very complicated psychiatric conditions with comorbid disorders. So the child fellowship here will enable the child psychiatrists that we are preparing to launch out into the world and to be able to really provide high quality care for children and adolescents.
There are some parts of it that are difficult, but I think that's true in all fields of medicine, that there are going to be these parts of it that are going to just be really hard. I'm really confident that the training I've received here is going to benefit me throughout my career.
JPS has really allowed me to explore different patient populations that I may not necessarily have gotten the chance to encounter.
I get to have this opportunity to meet people where they are, and you don't have a lot of the outside noise. It's just you, the patient, and what you can come up with to treat them, and it's a really special kind of bond that you have at a community hospital.
It's made me even more compassionate than I thought I could ever be. It's also taught me how to have boundaries, which is very important, especially as a psychiatrist. And I want to give back to this program, and I'm from this area, so my hope is to come back to JPS at some point.
I mean, the truth is you're gonna love being a child and adolescent psychiatrist. You are a family psychiatrist. You get to work with kids and families, and there's a sense of hope with the work we do. We could change the trajectory of their lives into adulthood, which is just a very rewarding feeling, knowing that you could have played a role in helping a child just feel better, do better, or even helping a family navigate the mental health challenges and needs that they're all facing. So they don't have to do it alone. You feel like there's purpose and reward to the work you're doing. So if you want to be somewhere where it's all about being together, well, family, have fun, diverse rotations and educational experiences, then we're the place to be.